My name is Shannon Schrader, and I live on Puget Sound with my husband Ted and our 2 daughters. In 2009, there were several days where I was just feeling crummy and felt like I had a cold and that it was getting worse. Climbing up the stairs with laundry was a chore. I would get to the top of the stairs and have to, catch myself, take a deep breath. I really wasn't feeling well, so I decided I need to make an appointment with my doctor. I went in and she was checking me out and took my vital signs, listened to my heart and said, "You're in atrial fibrillation." And that was something totally unexpected, that I thought she was going to give me medication for the flu, not tell me you're in AFib right now.
Atrial fibrillation is a rhythm disturbance of the heart that can cause strokes and heart failure. When people have high blood pressure or thyroid problems or valve disease, the left atrium or the upper chamber of the heart gets enlarged and it tends to go into a chaotic rhythm. They could feel really tired or short of breath, have chest pain. They can feel dizzy. When a patient comes in with symptoms that sound like atrial fibrillation, we would do an electrocardiogram in the office. But if we don't see it on the electrocardiogram, we should order a Holter monitor or an event recorder for 30 days.
We determined that I had been in it for several days because those were the symptoms that I was having. So she said, since it hasn't resolved itself, you will need to go to the hospital as soon as you can and have a cardioversion, which is the paddles to shock you out of the rhythm. So it was definitely something that frightened me.
Honestly, I think the biggest problem that I have with patients who have atrial fibrillation is their anxiety. The more they get it, actually, the worse the anxiety becomes. And so I think that the best way is to teach people about never getting the atrial fibrillation ever for the first time. And that is to lower their blood pressure, keep their weight down, exercise. If you feel that you have sleep apnea, get that treated because those are the triggers for atrial fibrillation. One of the worst complications of atrial fibrillation is getting a stroke. When somebody has a stroke in atrial fibrillation, it's devastating. It is the #1 cause of debilitating strokes in women.
So one morning we decided we were going to have a picnic, so I was making sandwiches. I made a couple, and when I went to make the 3rd sandwich, I tried to put the bread on the sandwich like I had done, a second before, and my hand wouldn't work. My arm couldn't pick up the piece of bread and make that 3rd sandwich. So it was pretty frightening, and I was thinking, oh no, what's wrong with me? Am I having a stroke? They determined that it was the AFib that had caused the clot, which led to the mini stroke.
When somebody has atrial fibrillation, the upper chamber of the heart or the left atrium doesn't contract. And so blood pools in the crevices of the atria. And these blood clots can break off. And 95% of these clots will go straight to the brain, causing a devastating stroke. Preventing strokes and atrial fibrillation is done by medications, and right now, that's the only approved way of preventing strokes and atrial fibrillation. The drugs to prevent strokes and atrial fibrillation is much more effective in women than in men, and that's why we need to be more aggressive in preventing strokes in women because it is more preventable in them. So the most important thing about preventing strokes and atrial fibrillation is knowing your risk of stroke. If you have a low risk, you don't need to do anything except maybe take a baby aspirin if you're over 65. But if you are at high risk for a stroke, make sure that you're on some oral anticoagulant or blood thinner to lower your risk. This is so important as a preventive measure.
have been diagnosed with AFib, and it's a part of my life, but it's certainly not a big part. I get to do everything that I want to do with my children. I can go out hiking and camping with them. I get to run around and be the mom and wife that